Well, important's a big word. I think I would say it's been valuable. And its greatest contribution, I think, is the development of the global network of collaborators that now it stretches across 120 countries and involves 40,000 surgical staff members across the world. And it's really about those surgeons working together to benefit their patients and improve the service they're providing. The contributions that have been made have been particularly in carrying out very large cohort studies. We now have data on over something like 500,000 patients across the world, all prospectively collected. That has been a huge effort, a huge benefit, particularly for the time of COVID, when we were able to gauge what surgical activity was going on. But also in other times, looking at hernia repairs and laparoscopic cholecystectomy outcomes, and identifying where the gaps are in surgical service across the world. I think the success is down to the network, and it is because this is a bottom-up strategy. So it's not about health ministers telling surgeons how to do their work or what to do. And there's a lot of things wrong in health services around the world with this top-down approach. So this is a bottom-up approach where surgeons identify the problems and work together to find solutions. The network has actually had a prioritization cycle every year, and it's identified where the key areas for developing research and where improvements are required, and annual face-to-face meetings where these are discussed and the interventions and projects developed and proposed. This has resulted in fantastic interventional trials that have changed practice across the world. Perhaps Cheetah is the best example, where we've reduced surgical site infection by 1 in 7 cases. And that's been implemented nationally in Nigeria. It's being implemented across the country in Rwanda and in Benin. And there's a big program being rolled out in India to try and improve surgical site infection that has emanated from this work. So really transformative projects led by surgeons trying to benefit their patients. Well, it's the annual World Health Assembly. And this World Health Assembly is attended by health ministers from across the world, participating countries. And they really set the priorities for the WHO for the forthcoming years through resolutions that they pass. Of course, they also set the priorities for funding, particularly for the governments. And so it's really important that surgery has a voice at this forum and that surgery is recognized as a global health priority. That is why we're attending. Oh, good question. Why should they? Well, actually, there are very, very good reasons why. Global health has focused on infectious diseases for good reason historically. But actually, the world health is changing and we're moving towards more chronic diseases. And now it's actually a case that more people die following surgery within 30 days than die from all the major infectious diseases across the world put together. Half the world's population still can't access safe surgery. It is the greatest health challenge facing the world today. And it is a complex challenge that requires investment and strengthening of whole health systems to deliver it. So if we don't speak up for our surgical patients, I'm afraid nobody else will. So it is absolutely essential that we give the WHO and the WHA the right information to understand how important surgical patients are to benefiting whole health systems. We would hope that surgery will stop being seen as an outsider and is more integrated into whole system strengthening. I would like a future where every new health innovation across the world embraces a component of surgery, so that surgery is incorporated into the strengthening of whole health systems. This has started. Resolution 76.2 was passed, completed last year, and that's about strengthening emergency, critical care and operative care together. So looking at that whole system rather than just surgery by itself. So we really need to bring surgery center stage, and this is the opportunity to do it. I think the future, I would like to say the future is in our hands. Sadly, that is not really the case. The future is in the hands of politicians. And at the moment, I think it's fair to say that there is a lack of understanding of the needs of global health. And I'm afraid when Western rulers can pass resolutions that actually are causing the deaths of innocent, vulnerable people across the world, we all really have to question our values. So these are very challenging times, and it's important that we stand up and be counted. In truth, I believe in the strength of humanity, and I think that this will change. But we can't just stand back and allow things to happen. We need to stand up and speak up on behalf of our patients. If we transform the lives of patients across the world, we make the world a stronger and better place for everyone.